Hello, my name is Alexis Peraza. Did you know that the American Heart Association estimates that 100,000 to 200,000 adults and children's lives could be saved each year if CPR was done early enough? Today I'm going to talk to you about the proper steps that need to be taken in helping someone who is injured and needs help. Understanding how we can better assess the situation and help until more help gets to the scene can help to save someone's life one day. As someone who is first aid and CPR certified, today I hope to show you how to help if you are not certified, or to convince you to become certified to fully understand the proper things to do in different situations. Today we will talk about, first, how to size up the scene to be aware of what you are walking into. Second, to make sure to get consent to help someone to also protect yourself in the unfortunate event that something happens. Finally, third, a couple different things that can be used to help someone until medical help comes to either take them to the hospital or clear them to be okay. First, let's talk about how to size up the scene to make sure you are aware of what you are walking into. You need to check the whole scene to make sure it's safe. It's important to do this because you need to stay safe as well. If you are injured, you will be no help to anyone else. It's also important because it's going to be chaotic already, so checking the scene can help avoid as much confusion as possible. It's also important because if there are multiple injured people, checking the scene will help to point out who needs the most help before helping everyone else. Now that we have talked about sizing up the scene, let's move on to our second point. Second, let's talk about making sure to get consent before helping someone out. No matter how good your intentions may or may not be, you need to make sure to get consent before being able to help anyone out. Sadly, things can go wrong at any time and may not be anyone's fault. Proper consent means a good Samaritan law comes in effect, which needs two conditions to be met. The care needs to be given at the scene of the accident, and if the person giving aid wants to be paid a fee or given a reward, the law will no longer apply. Now that we have talked about getting proper consent to help someone and to protect yourself, let's talk about our third point. Finally, let's talk about the different things that can be used in some different situations. There are many different situations and different things that can be used. Today I will tell you about a couple different actions that can be taken. For example, if someone is having a heart attack, you need to sit or lie them down to try to keep them as calm as possible and remove any tight clothing they may have. If they have any pain medication, you can try to give it to them. If not, you can also try to give them a baby aspirin to chew to thin out the blood and help slow down blood clotting. And of course, you need to stay with them to keep them as calm as possible until medical help arrives. In the case that someone is not breathing, first you need to make sure the person is lying down on a flat surface. Tilt their chin up to open their airway. Proceed to give them 2 rescue breaths followed by 30 chest compressions, which you can do by interlocking your fingers and placing your hand on the center of their chest. Repeat this process for 2 minutes or until medical help arrives. We have now covered 2 ways to help someone if they are having a heart attack or not breathing. We have now covered the proper steps that need to be taken in helping someone who is injured and needs help. We have talked about, first, how to size up the scene and be aware of what you are walking into. Second, to make sure to get consent to also protect yourself in case something happens. And third, a couple different things that can be used to help someone until medical help arrives. Now, if someone's having a heart attack and no longer breathing, you can be his or her saving grace and be someone's hero one day.